Then from the treatment side, we're actually in the room now that is at our main office at a corner house on the 11th floor. This is our outpatient counseling center program. It's modeled on what they call Employee Assistance Program, EAP. And so this is a program that reaches into industries. Either that could be government-sponsored programs, or it could be private in the public area. And so we offer various services under our EAP program. One of it is what they call outpatient counseling. So this would be somebody who has an alcohol or drug or mental disorder problem, and they want to be screened and assessed to see the severity of the program. And then we would see whether they would qualify for outpatient. If they need inpatient, we don't have inpatient at this time, we would refer them to treatment centers that we feel give quality services in Nairobi or beyond. We also have an adolescent intervention program, so we'll be working with schools. And we also have it's a very interesting program. We're working with what we call naltrexone, implantable naltrexone. Naltrexone is a medication that we have our, what they call COO, our Chief Operating Officer, Dr. Lincoln Hasahala. He's a medical doctor, he's a mental health researcher, he's a clinical psychologist, and he's a senior lecturer at the psychiatry at the University of Nairobi. So for the last 2 years, he's been implanting naltrexone just below the skin on the left side near in the abdomen. And this reduces craving for about 3 months. The medication lasts for about 3 months. And so he has had, for those who are what we call kind of genetic alcoholics, these are men particularly, but it was women also, in their 30s and 40s who've been drinking for a long period of time. And so this, plus counseling, plus outpatient counseling, has been very successful for now many people who are on this implantable naltrexone and counseling. And then finally, on our last part, our focus is also on research. At this time, we have a major grant from the U.S. government with the University of Washington in the United States and Kenyatta University. And under that, they call it NIDA, National Institute of Drug Abuse grant. It's a 5-year grant. We're in our 33rd week of that program. So we're identifying 1,000 new HIV/AIDS positive people who inject drugs in our program. And we're also identifying their sexual or drug sharing partners. And then the focus of this is both for the HIV/AIDS side, for those who are not yet in treatment, to get them into treatment. And kind of a unique part of this particular research is that we're also identifying hepatitis C. People who share drugs, share the equipment I should say, they have a higher rate of hepatitis C. Now our hope is, and it's a pretty high percentage, I mean we've seen so far, about 1/3 of our clients have both, about 1/4 of the partners have HIV/AIDS, and about 1/4 have hepatitis C. So we'll be able, through the government here, in the next few months, to be able to offer hepatitis C medication to treatment. Hepatitis C is a disease of the liver. Usually it takes long years to develop, but it can be quite serious and deadly if it's not treated. Now the available treatment in the United States, we're talking $30,000, $40,000, $50,000 per treatment or more. This will be available free to those clients that will be identified under this NIDA research grant. So that's going to be a significant research